Hi, my name is Anna, and I'm a physical therapist at Mass General Hospital. Today, we're going to be reviewing postoperative spinal precautions so that you are familiar with how to educate your patients on how to maintain spinal precautions after surgery. Today, we will review postoperative spinal precautions and positioning recommendations. We'll demonstrate how to incorporate spinal precautions into mobility to keep patients and providers safe. So what are postoperative spinal precautions? A good way to remember spinal precautions is through the acronym BLTs. So we want our patients to limit bending, lifting greater than 5 pounds, or twisting after spine surgery. For lifting restrictions, a reference for common household objects is a gallon of milk is about 9 pounds, so your patients should not be lifting that. But a liter of soda would be okay because that is about 3 pounds. The goal for spinal precautions is to keep a neutral spine. So we want to keep the ears, the shoulders, and the hips all in alignment. So why do patients have spinal precautions after surgery? 1 is to reduce pain. 2 is to allow healing at the surgical site. 3 is to allow for safe and early mobility after surgery. So what positions will be comfortable for your patients after spine surgery? One position is in supine, or your patient's laying on their back. You should be putting a pillow underneath their knees, 1 or 2 pillows, as this will reduce the strain on the lower back. Another position that may be comfortable is on the side, with the hips and the knees slightly flexed, a pillow between the knees, and a pillow behind the back to limit twisting at the back. For sitting, choose a chair with good back support for your patient. Again, the goal is to keep a neutral spine. So we want the ears, shoulders, and hips all in alignment. Avoid the patient slouching forward. You may want to consider using a small pillow or a small towel roll behind the lower back to reduce the strain the patient is feeling. You want to avoid the patient statically sitting for longer than 30 to 40 minutes at one time. The patient may take breaks by standing or walking. So how do we incorporate spinal precautions into mobility? The first thing we're going to go over is the log roll technique when your patient is ready to get out of bed. What you want to remember doing is when the patient is ready to get out of bed, flatten the head of the bed first if they're in a hospital bed. First, you want your patients to bend their knees and their hips slightly. Roll onto their side first, limiting twisting at the spine. Once they're on their side, bring the legs over the edge of the bed and push up with the arms on the bed to come to sit. If necessary, the patient may help themselves roll onto their side using the bed rail. That is preferable than them pulling on you to come sit up. Now your patient is ready to get out of bed. Mobilizing patients out of bed is safe and highly recommended. But be aware of common signs and symptoms after spine surgery, like orthostatic hypotension or lower extremity weakness or sensory loss. Now your patient is ready to stand. You want to have them scoot to the edge of the bed first. And when they're standing, you want them to avoid bending over too far. Instead, have them stand straight up with their head pointed towards the ceiling, using their legs and their arms as needed. Walking is one of the best activities a patient can do after spine surgery. The patient may benefit temporarily from using an assistive device like a walker. This can always be removed during a physical therapy session if needed. When the patient is walking, you just want to cue them to again maintain a neutral spine. So keep the ears, shoulders, and hips all in alignment. There are some other common daily activities that will occur during routine nursing care where you may need to remind your patient to follow their spinal precautions. One of those common activities is reaching for objects. If there is an object in front of the patient, you want to make sure they walk up close to that object to reach for it, to limit them bending over at their spine. If the object is next to them, you want to make sure that they're moving their feet to face that object so they're not twisting at their spine. If the object is lower down, on the floor say, you want them to make sure they were using their legs to keep the spine in a straight line. They can do this by doing a squat or by doing a lunge to pick up the object. Another common activity where you may need to remind your patient to maintain their spinal precautions is when they are dressing. If they need to put on their shoes and socks, you want to avoid them bending over to reach for their feet. One way to do this to maintain your spinal precautions is by bringing the foot up onto the opposite knee in a figure 4 position. Or if they have help at home, they may need a family member to help them put their socks and shoes on. During the hospital stay, physical therapy will review body mechanics with patients to make sure they are adhering to their spinal precautions throughout their mobility and daily activities. Mobilizing patients is safe and highly recommended after spine surgery. Remember the BLTs and positions of comfort reviewed in this video to help maintain a neutral spine, to encourage healing and to reduce pain for our patients.